What is cirrhosis of the liver? Cirrhosis is a late-stage liver disease and a chronic, ongoing, long-term disease of the liver in which healthy liver tissue is replaced with scar tissue and the liver is permanently damaged. Scar tissue keeps your liver from working properly. Many types of liver diseases and conditions injure healthy liver cells, causing cell death and inflammation. This is followed by cell repair and finally tissue scarring as a result of the repair process. The scar tissue blocks the flow of blood through the liver and slows the liver's ability to process nutrients, hormones, drugs and natural toxins, poisons. It also reduces the production of proteins and other substances made by the liver. Cirrhosis eventually keeps the liver from working properly. Late-stage cirrhosis is life-threatening. However, the damage that's already been done by cirrhosis can't be undone. But your liver can still work and bounce back even if 2/3 of it has been destroyed or removed. What are the symptoms of cirrhosis? The symptoms of cirrhosis depend on the stage of your disease. In the beginning stages, you may not have any symptoms. If you do have symptoms, some are general and could easily be mistaken for symptoms of many other diseases and illnesses. Early symptoms and signs of cirrhosis include tiredness, fatigue, or even exhaustion, fever, weakness, nausea, loss of appetite leading to weight loss. Many people do not know they have cirrhosis until they have a complication. As liver function gets worse, other more commonly recognized symptoms of cirrhosis appear including jaundice, yellowing of the skin and eyes from the deposition of bilirubin in these tissues. Bilirubin is a product of the breakdown of old blood cells in the liver. Fever, vomiting, diarrhea, itching, from deposition in the skin of products of the breakdown of bile. Abdominal pain, from an enlargement of the liver or formation of gallstones. Abdominal swelling or bloating, from fluid retention. Weight gain, from fluid retention. Swelling in ankles and legs, edema, from fluid retention. Difficulty breathing, from fluid retention. Sensitivity to medications, due to impairment of the liver's ability to filter medications from the blood. Confusion, delirium, personality changes, or hallucinations. Encephalopathy, from buildup of drugs or toxins in the blood, which then affect the brain. Extreme sleepiness, difficulty awakening, or coma. Other symptoms of encephalopathy, bleeding from gums or nose, due to impaired production of clotting factors. Easy bruising, due to impaired production of clotting factors. Blood in vomit or feces, due to bleeding of varicose veins caused by liver congestion, hemorrhoids. Varicose veins in the rectum due to liver congestion, loss of muscle mass, wasting. In women, abnormal menstrual periods, due to impairment in hormone production and metabolism. In men, enlargement of the breasts, gynecomastia, scrotal swelling, or small testes, due to impairment in hormone production and metabolism. What causes cirrhosis of the liver? It's important to know the cause of your cirrhosis so you can get the right treatment and keep it from getting worse. A wide range of diseases and conditions can damage the liver and lead to cirrhosis. The most common causes are chronic alcohol abuse, chronic viral hepatitis, hepatitis B, C and D, fat accumulating in the liver, non-alcoholic fatty liver disease, iron buildup in the body, hemochromatosis. Cystic fibrosis, CF, is a genetic disorder. Copper accumulated in the liver, Wilson's disease. Poorly formed bile ducts, biliary atresia. Alpha-1 antitrypsin deficiency. Inherited disorders of sugar metabolism, galactosemia or glycogen storage disease. Genetic digestive disorder, Alagille syndrome. Liver disease caused by your body's immune system, autoimmune hepatitis. Destruction of the bile ducts, primary biliary cirrhosis. Hardening and scarring of the bile ducts, primary sclerosing cholangitis. Infection, such as syphilis or brucellosis. Medications, including methotrexate or isoniazid. Dangerous complications from cirrhosis. Cirrhosis can lead to several other conditions, some of which are life-threatening. These include ascites or edema. Ascites is a buildup of fluid in the abdomen, and edema is a buildup of fluid in the legs. They can be treated with a low-salt diet and water pills. In severe cases, the fluid may have to be drained repeatedly. Surgery is sometimes needed. Varices and portal hypertension. These are large, swollen veins in the esophagus and stomach. They can increase pressure in a blood vessel called the portal vein that carries blood from the spleen and bowel to the liver. Varices can rupture, causing severe blood loss and clots. Hepatic encephalopathy. This refers to high levels of toxins in the blood where the liver is no longer successfully filtering them all. Hepatocellular carcinoma. This is the most common type of liver cancer. It is the third leading cause of cancer mortality across the globe. Hepatopulmonary syndrome, HPS. Doctors define HPS as a combination of liver disease, dilated blood vessels in the lungs, and abnormalities in the exchange of gases. It is linked to an increase in the mortality rate of people waiting for a liver transplant. Coagulation disorders. Cirrhosis can cause problems with blood clotting, leading to potentially fatal bleeds and clots. Other complications from cirrhosis include sensitivity to medications. The liver processes medications in the body. Kidney failure, insulin resistance and type 2 diabetes. Gallstones. Interference with bile flow can cause bile to harden and form stones. How to accurately diagnose cirrhosis. Because there are rarely symptoms early on in the condition, cirrhosis is often diagnosed when the patient is being tested for some other condition or disease. Anybody who has the following symptoms should see their doctor immediately: fever with shivering, shortness of breath, vomiting blood, dark or tarry stools, episodes of drowsiness or confusion. A doctor will examine the patient and feel around the liver area to determine whether it is enlarged. The patient will be asked about their medical history and lifestyle, including drinking. The following tests may also be ordered. Blood test. These measure how well the liver is functioning. If levels of alanine transaminase, ALT, and aspartate transaminase, AST, are high, the patient may have hepatitis. Imaging tests. Ultrasound, CT, or MRI scans can be used to see whether the liver is enlarged and detect any scarring or nodules. Biopsy. A small sample of liver cells is extracted and examined under a microscope. The biopsy can confirm cirrhosis and its cause. Endoscopy. The doctor inserts a long, thin tube with a light and video camera at the end, goes through the esophagus and into the stomach. The doctor looks out for swollen blood vessels called varices that can be a sign of cirrhosis. What are the treatments for cirrhosis? Cirrhosis isn't curable, but it's treatable. Doctors have two main goals in treating this disease: stop the damage to your liver and prevent complications. Treatment includes correcting or treating the cause, such as alcohol abuse, exposure to a toxin, hemochromatosis, or chronic hepatitis. Treating complications as they develop. Sometimes transplanting a liver. The best approach is to stop cirrhosis in its earliest stages by correcting or treating the cause. Treating the cause usually prevents any further damage and sometimes causes the person's condition to improve. Treating causes. People are given the hepatitis A and B vaccines if they have not had them before. To prevent cirrhosis from progressing, people should stop drinking alcohol completely, even if alcohol is not the main cause of their liver problem. Drinking even moderate amounts of alcohol can be very harmful to the liver once cirrhosis is present. Withdrawal symptoms, if they occur, are treated. People must inform their doctor of all the drugs they are taking, including over-the-counter drugs, herbal products, and dietary supplements, because the damaged liver may not be able to process, metabolize, them. If people need to take drugs that are metabolized by the liver, much smaller doses are used to avoid further damage to the liver. Also, people may be taking a drug that can damage the liver and thus contribute to cirrhosis. Such drugs are stopped whenever possible, and another drug is substituted if needed. For hemochromatosis, bloodletting is the best treatment. Chronic hepatitis is treated with drugs, such as antiviral drugs or corticosteroids, and sometimes liver transplantation. Treating complications. For complications, treatment includes, for accumulation of fluid within the abdomen. When cirrhosis is advanced, restriction of sodium in the diet because excess sodium can contribute to fluid accumulation. Drugs can help eliminate excess fluid by increasing the amount of urine produced. For vitamin deficiencies, supplemental vitamins. For hepatic encephalopathy, drugs to help bind toxins in the bowel, in the stool, and antibiotics to reduce the number of bacteria in the gastrointestinal tract that produce these toxins. For bleeding from the digestive tract varices, beta blockers to lower blood pressure in the liver's blood vessels and/or application of elastic bands to tie off the bleeding blood vessels, called endoscopic banding, or ligation. To place the bands, doctors use a viewing tube, endoscope, inserted through the mouth. If beta blockers or band ligation cannot be used or is unsuccessful, doctors may use one of the following procedures: Endoscopic cyanoacrylate injection. Doctors pass an endoscope through the mouth and into the digestive tract. Working through the endoscope, they inject cyanoacrylate into the bleeding vein. The cyanoacrylate closes the blood vessel and bleeding stops. Balloon-occluded retrograde transvenous obliteration. After injecting a local anesthetic, doctors make a small incision in the skin over a large vein, typically in the neck or groin. Then they insert a thin, flexible tube, catheter, with a deflated balloon at its tip into the vein and thread the tube to the site of the bleeding. The balloon is inflated to block blood flow. Then a substance that causes scar tissue to form is injected in or near the vein to block it and stop the bleeding. Transjugular intrahepatic portosystemic shunting. Tips. Doctors insert a catheter into a vein in the neck and, using X-rays to guide them, thread the catheter to veins in the liver. The catheter is used to create a passage, shunt, that connects the portal vein, or one of its branches, directly with one of the hepatic veins, which carry blood from the liver to the body's largest vein, which returns blood to the heart. Thus, most of the blood that normally goes to the liver is rerouted to bypass the liver. This procedure lowers blood pressure in the portal vein because pressure is lower in the hepatic veins. By reducing this pressure, TIPS helps reduce bleeding from the veins in the digestive tract and accumulation of fluid within the abdomen. Liver transplantation. For suitable candidates, liver transplantation may be done. If transplantation is successful, the transplanted liver typically functions normally, and the symptoms of cirrhosis and liver failure should disappear. Liver transplantation can be life-saving for people with advanced cirrhosis or liver cancer. Liver transplantation is usually done based on how likely people are to die if they do not receive a liver transplant. How to stay healthy with cirrhosis. To keep your liver as healthy as possible, make a few changes to your lifestyle. Eat a liver-friendly diet. Cirrhosis can rob your body of nutrients and weaken your muscles. To combat these effects, eat lots of healthy foods like fruits, vegetables, and lean protein from poultry or fish. Avoid oysters and other raw shellfish, because they contain bacteria that could cause an infection. Also, limit salt, which increases fluid buildup in your body. Get vaccinated. Cirrhosis and its treatments weaken your immune system and make it harder to fight off infections. Protect yourself by getting vaccinated against hepatitis A and B, the flu, and pneumonia. Be careful when you take medicine. Cirrhosis damage makes it harder for your liver to process and remove medicines. Ask your doctor before you take any over-the-counter drug, including herbal remedies. Be very cautious about medicines that can cause liver damage, like acetaminophen, Tylenol.